So, our last speaker of the day, and I have to say, I don't think I've ever introduced the winner of the Extraordinary Woman of the Year before, which is absolute first for me, and a finalist for the Yorkshire Woman of... Who were the other women in Yorkshire that beat you then, if you were just a finalist? But Kate Allen is a brainstem stroke survivor. She was diagnosed with locked-in syndrome, but I'll let her tell you that story. And she's a published author. She's been on the television, I'm sure you've seen her, and she founded Fighting Strokes charity. So please welcome Kate Allen.
Well, thank you very much. I have to say, it's an honour to be here talking, so thank you. But more than that, it's an honour that you all stayed. And I've got the graveyard shift, but I'm really happy with that turnout. It's good, so well done for that. Now, today, I'm doing something very different. You may have heard me in the media, you may not have, I don't know, but I'm kind of bored about telling the story in the way the media like it told. So today, for me, the reason I want to do this is very content-driven, so you have to bear with me, is to share my experience so that maybe that will help and inform the way you deal with people like me out at work. So I hope you find it really practical, because I do practical, that's how I am. And the other thing is, buy the Sunday Times this Sunday, because there's something in the magazine that's not to do with my story, but to do with the work my charity does. So you just got the inside gen on that. Anyway, I'm gonna cut to the chase. I was 39, a big fell runner, and on Sunday the 7th of February 2010, I had a stroke. Serious stroke. I ended up in a coma for 3 days as they shut down the brain, and the actual diagnosis, which won't be lost on you clinicians, is a right vertebral artery dissection and occlusion with an acute infarction of the pons. So it was pretty severe. So much so, what it feels like to wake up when you've had heavy sedation is, when I was in the coma, I was totally unconscious. There was no Disney-fied or anything like that. It was just my life lost 3 days, end of. But however, when I woke up, I was very heavily sedated, so my pupils didn't work properly. But when I was awake, I was conscious. But it took 2 weeks for the medical staff to realise I was conscious. 2 weeks of watching people die and listening to a relative screaming next to me with no one to comfort me or talk to me or try and find ways to communicate with me. But that's another story, and I'm not going into that side of it. But the point is, when you wake up, I woke up with locked-in syndrome. It was actually locked in, but I was diagnosed with locked-in syndrome, and that means I could move nothing, no speaking, no moving, no nothing, no eating, obviously. I felt everything. So it's like paralysis with pain. Now, when you've been 3 days in a coma and you've not moved, then you're fairly stiff. So I had terrible pains with stiffness, with cramps, and I couldn't tell people. I couldn't even relieve my cramp. I couldn't do anything. But that's again another story. I'm missing a lot of my story out because I really want to get to the point of being here. In rehab, I went to Osborne 4 in Northern General. I have a pick-sick personality. That's me all over. I drive people insane, especially my husband. But I've got 3 kids at home who are at the time 6, 9 and 10. And as a mum who was 39, I would say my motivation wasn't writing a book or doing the charity. It was getting home, because I thought, how the hell are they going to function without me? My husband worked abroad all the time. He knew nothing about the day-to-day running of the family and all the things you have to do as a mum. So what did I do? My right side came back at week 8. When I say right side, I mean my right thumb moved half a millimetre, that's all I had after week 8. I had a tracheotomy, a peg, a catheter, and I'm fast forwarding a little bit, but Before this slide, something I have to tell you because I think the psychologist's here. Unbeknown to me at the time, the psychologist that was assigned to me in rehab, which actually should have been assigned as a nominated patient advocate, as one of my hot potatoes in ICU, that's a different issue, had said to my very best friend, when my spark came back because of a series of events that triggered my motivation and my drive, instead of not wanting to exist and to die, actually to fight and get home to everybody, was the psychologist took my friend out of the room, unbeknown to me, and she said, "We have a problem. Kate's expectations are here and ours are here. You need to bring Kate down to us." And she said, "No, damn you, you need to go up to her." And I thought that was bloody good, actually. It wasn't patient-centred. There was a lot of good stuff I received, but it wasn't patient-centred. Anyway, some point later, about 4 months later, nothing's moved on this side at all. Bits started to come back on this side, but nothing on this side. I was having FES on this side. I swear by that, but that's another issue. I took it upon myself. There was Jeremy Kyle on there. There was This Morning. There was Bingo. It was all crap TV. And all I had to do when the session stopped at 2, when the relatives could come and visit me, I used to sit on my bed and I used to will. Now what I used to do is first thing I did was focus on my big left toe. And what I thought, I was looking at my toe at the time. I had a bit of neck movement at that point, and I was thinking in my head, move, bloody move, just move. And I did this for about 3 or 4 weeks. Did it all day, every day. Forget the 3 lots of 10 next. I did it relentlessly. And after 3 or 4 weeks, I got tiny little flicker. So much that my best friend was also visiting with my mum, and she said, "Jan, Kate's toes just moved." She goes, "Alison, you know it hasn't. Don't raise her expectations." No, it hasn't. "Jan, it has." "It did, didn't it, Kate?" And I blinked twice for yes. And she said, "Do it again." And I only was able to move it once before it fatigued. And she saw it, and my mum ate her words. So from that, I totally believe in my Kate approach was willing. That was my approach. Repetitions. Think about lengthening the nerve. And what was going through my mind was, if I could make the left toe work, that being the farthest from my head, game on the rest of my body. That's how I thought. That is how I thought. So when it moved, it was like being at the fun fair with the test of strength. You know, it was like bing as I got that movement. That was like the bell sounding. But I was written off again. I don't want to go into that now. But I think certainly the message for this is, you must throw everything at someone like me. Some people are locked in for a day, a week, forever. Some people make the most amazing progress. I've seen hundreds of cases all around the world. I get emails on a daily basis with my charity. Everyone's different. Where you fit on that scale with locked in varies from Tony Nicholson to Kate Allett, and there's so much in between. Tony Nicholson to Christine Waddell. She's been locked in for 17 years. She manages my Fighting Strokes Facebook page. She loves it, and she's so happy. She doesn't think like him. We're all very different, just as strokes are all very different. Anyway, sorry, what I wanted to know is, I wanted to pick each discipline that dealt with me and tell them what I think the benefits of my experience are. So if I take nurses, what I think you should know. I had a tracheotomy, right? Not very pleasant. If I go and see people in ICU, I don't mind seeing somebody in locked in, as distressing it is, but when I have to hoover out the trachea, that's when I have to leave the room. It takes me back to a place I don't want to go to. It's a horrible sound. But what you may not realise is, on top of all the stress of people dying and not being able to eat and not being able to move and not seeing your relatives or your kids or things, this bloody tracheotomy pops off 8 times a week. Just randomly shoots off. Now, when that's breathing for you because you're on a ventilator and you can't raise the alarm to tell somebody your breathing machine's gone, and you're hoping they're going to see it when the lights are dimmed at night or hear it, that's an unnecessary stress. Why the hell aren't tracheotomies fixed? The thing I would say is, it's a continence week. It's a big issue with stroke, it's a big issue with brainstem stroke. I had to start, flip flowing my catheter. They pulled that out by mistake, but having to retrain my body, it was like being a toddler, having to be potty trained. One thing I would say to nurses is when someone is off a catheter, the most important thing is that whenever I got to a point where I could ring the bell at that point because I was catheterised for so long, they don't come to the room, ask what's wrong, go back and get the pot to the bedpan, then bring it back, because by which time, after you've been catheterised for 6 months, you ain't any ability to hold that in. And so you've suffered the degrading situation of wetting yourself, basically, even when you knew that you needed to go. So even when I communicated that when I ring, always assume I need a bedpan, unless I don't, and do it that way. But that's the tip. The other thing as well is, to be patient-centred. We talked about the patient-centred, the self-managed. I think I'm an example of self-managed, and I know I'm very different, but I've always been like this, very determined. And that is crucial, that you work out what fires up the patient. I wanted to run before I could walk. You might laugh, but that's true. I didn't want to just walk. My first goal was to walk off the hospital ward. I did that, it's on YouTube. It gets a lot of hits. It's very emotional. But I was told 3 months earlier that would never happen. People can be too negative. All the medics I dealt with were so worried about raising expectations, raising hopes. In that first 6 months, everything goes. Bloody well, lift the family, who have a massive effect on the patient, and the patient, after 6 months, review things. Where have we got to? And don't make judgments on other people and averages. And the other thing I would tell you is that, when you have something like I had, you've got to learn everything again, from writing to going to the loo, to sitting in a chair, to being able to sit on a cushion, even if it's an inflated cushion, it's painful. There's so much you can do. And the other thing, I said it was like going from 39-year-old 70-mile-a-week fell runner, which I was, to completely incapacitated like a baby, to a toddler, and then, I've come back to myself again, but I've gone through the whole gamut of things. But the other thing I would say to nursing staff is students. I had 2 of the most amazing students. I had a lot of students who weren't so amazing. And it's very easy to send the bloke student, to fix the Inco pad on the brainstem stroke survivor, because they can't argue and they can't complain. They might need it changing, and they come and they do it, and they take about 4 times longer than a regular nurse. Now, when you always constantly feel practiced on, that's not a nice feeling. When everything else has gone out the window anyway. So I'm not tarnishing all students like this, but some were more committed than others. The good ones were doing my hair in French plaits and my nails and plucking my eyebrows, and they were brilliant. We had discos on the ward, so I ain't saying that about all nurses or all students, but it's something to bear in mind. You don't want to be a guinea pig. Now, OTs, I think we talked about repetition. I totally and utterly endorse that. It's been mentioned in all the presentations. It's something I worked out myself, but I can only say that I'm here doing this now, and that was exactly what I did. FES, I've got to be in my bonnet about that, because they used it as a guinea pig on my left side, because they threw everything at me because I was young. They could identify with me as a mother, 3 young kids, blah, blah, blah. And I swear by the fact that helps bring this back to life. So I'm really interested in anything to do with that. And humans love repetition. You've said it all yourself, and that's true. And I think the FES, the other point I was going to make is that we need to be using FES the minute you come out of the coma. I'm going to put that idea out there. That's my idea. That I think we'd have the sort of results Denmark has. They have the best results. We could improve progress improvement rates in any other country in Europe. And they do that because they start rehab straight after the coma. So stuff I think speech therapists should know is this might be known to you, but one of the things I had the risk of was silent aspiration. You know, where your fluid goes, I'll tell you this, your fluid goes down your lungs. Well, I was first given tea after 2 weeks, sips of, and then they realised when they hoovered out my trachea it was going down my lungs, so they stopped it, much to my absolute annoyance, as you've probably read. And someone came up with the idea of putting dye in a bit of water to see when they sucked that out whether the water was blue, because if it was blue it was going down my lungs. And it was, so it was definitely off limits. I was nil by mouth for 6 months, which really crucified me. But that idea, I only share that with you. It's in my Running Free book, because I've been to see lots of people, but I went to Belfast recently, and the nurses on the ICU unit used the idea from my book to test on this guy. So, and I know other people have been using lots of things in my first book. The other thing was I learnt how to swallow again with chilled ice on a teaspoon. No, sorry, a chilled teaspoon, no ice, to help me get the reflex back, and then it was chilled teaspoons of iced water. That was brilliant, because I was never expected to talk again, if you can believe that. But the only other thing I think speech therapists should know is, and this might surprise you, in ICU I was given a card marked A to Z after 2 weeks. Now, can you imagine the frustration when they think that they don't think, they know you've had a stroke, so they think, oh, she's a bit stupid now, because they don't know it's down here and not there. And we work out a system of communication through blinking. So 1 blink no, 2 blinks yes. And my husband, bless his soul, I was trying to spell out the word leg cramp. I went all the way around. It took about 20 minutes to do 1 word the first time I did. Anyway, I got to G, and there was nothing on the board for me to show me, to show him it was the end of a word. So we got to G and he went, C. Kate, I'm sorry, but that's not right. The most frustrating thing in the world, not having an end of word box. Now, they had it in rehab, but they didn't have it in ICU, and I was there 9 weeks. And a lot of people have picked up on that and thought, that's so simple. Well, it is. But it caused me a lot of frustration, and Mark. Now, psychologists, the hidden sides of stroke, the emotional sides, the depression, the post-traumatic stress, the withdrawal, the self-esteem issues, the parenting issues, the relationship issues, the continence issues, and the worry about going out where there's not a loo. They're enormous. I know the Stroke Association this year focused on that because it was an idea I gave them last year. But it's so, I mean, I'm so into rehab and the emotional sides of stroke, and it's an area that I'll keep campaigning for, because it's so misunderstood with families, with carers, with professionals, and with stroke survivors. They don't know what's happening to them. The nominated patient advocate, I mentioned this before, in ICU, I wished I'd been offered at least twice a week for 20 minutes, someone, in the event that someone like me came in as a patient, had done the training to sit with me and try and figure out a way of communicating with me, whether it's holding up pieces of paper, yes, no, or blinking, or rolling eyes up and down. I had nobody. I was petrified. Absolutely petrified. It was horrendous. At one point, I was convinced I was being killed off by the nurses with a graphite drip. Doesn't exist, but I was hallucinating. But I'd sweat pour off me because of the stress, and I had no one to talk to. And I figured that in every trust there should be someone who could just step in for 20 minutes twice a week to sit with someone like me. The post-traumatic stress disorder is absolutely dreadful. Just to give you an idea, I came out of hospital and my husband took me in a wheelchair to Sainsbury's. Now, when I was in Sainsbury's, I had a panic attack because I was convinced that I wasn't actually in Sainsbury's. That was a dream. I was actually lying flat on my back in Osborne 4. And I had to pinch myself, literally, to convince myself it wasn't true, and I was actually in Sainsbury's. Post-traumatic stress is a big issue. The support And the fact that psychologists, a bit like the point I made earlier, must not worry about squashing hope. It should all be about give it everything for the first 6 months and then take a view on it. Now, I know there's politics involved with figures and everything else, for costs and everything, but that's how it should be. And certainly not with the loved ones. Every single body, without fail, who emails me day 3, the week after, 2 weeks after their loved one's brainstem stroke, they email me, one, to either say, I've been told by the medics that he's absolutely got no chance, and I will not believe it, and they're thinking, she's just desperate, she wants a husband back. Part of that's true, part of it isn't, part of it's their ignorance. And the other thing they do is they've already given up, so they're asking for funding. I don't do funding as a charity, that's not what I'm doing it for. But you mustn't alienate the loved ones. They've got to be there fighting for them. I'm just going to show you a video. This video here is the day before my first stroke anniversary. As I say, the video of me walking out of hospital is very emotional. It's on YouTube. But this video here is my next goal after walking out of hospital. Prior to that, it was eating and having Christmas dinner. But my next goal was to run by my first anniversary. Now, I just to let you know, I was in a wheelchair for 6 weeks. And then I went on sticks for another 6 weeks. And after that, he got this lovely guy here that I'll tell you all about later, got me able to realise my goal of running by my first anniversary. For me, that was a very emotional thing because that was a huge goal of mine that I realised. And yes, it wasn't a run, it was a shuffle and it was only 10 yards. But listen, when you've been in a wheelchair and on sticks and on a frame, that was big news on uneven ground in the bloody woods. So I was very pleased with myself for that. We've gone out of sync here, but never mind. And then my next goal was to run by the 4th of December and to run properly for the Percy Pud race. And that was a culmination, just let me tell you. Talk about self-management. From the day I left hospital, I've got to share this with you. The week before I left hospital, my husband took me to Sporter, which is my local gym, because I had the brainwave that actually when I got in the community, the care wasn't going to be great and it wasn't going to last that long, and if I wanted to run by my first anniversary, that wasn't going to happen. And sure as hell, they got me practicing sitting up and down, and I wanted more than that. I wasn't an old age pensioner, and I had more about me. So unfortunately, I sacked the physio. She was very nice, but I did sack her. And I went to the gym and I spoke to the manager who knew me, and I said, listen, can me and my family have free membership? Because I needed help in the pool and everything else with all my neck floats and waist floats and everything. And he said, absolutely, Mrs. Alec, as I've been there for years. He said, we'll give it a whole membership to the family. He said, but on top of that, I'm going to chuck my very best physio in until your first anniversary, because we're going to bloody well get you running. And I was like, wow. Because up until then, I really thought I could get myself better on my own. A bit silly, but there we are. But he was marvellous. I got a taxi to pick me up every single day at 9 o'clock to drive me to the gym till I got my licence back. And every single day he did FES on me, he did acupuncture on me, he took me through the gym, he held me, he gave me the confidence you need to walk upstairs. I mean, he was phenomenal, but that was my resourcefulness. And I said, well, I do all that for you, do that for me, and I'll get you some free PR for your gym. And they said, deal. And that was it. But so I did that relentlessly for 18 months. And to be honest, with all my rehab in hospital, which was damn hard work, and all the work I did at home every single day without fail on my own, got to this race, and I didn't react like I did in that first anniversary stroke. I reacted like, thank God for that. But I have to just show you the culmination of all my effort. And it's here.
That's amazing, Kate.
So I got where I wanted to get, and that's really allowed me to focus in on the charity work that I do. But just so you know, I know all strokes are different. I know all motivations are different. I know all patients are different. I know all support is different. But I think progress is always possible with anybody. It depends on what their goal is. And it's all about bite-sized goals. I had an ultimate goal, but that had to be broken down into bite-sized goals, you know. And last June, I went to the UCL because they wanted me to take part in a research project, and they wanted to re-MRI scan my brain, which they did because they couldn't understand why I can do all this. I have no impairment. I've got a bit of tendon shortening in my fingers, which is nothing really. And they re-scanned my brain and said, oh, we might not be able to see the stroke. I said, all right. Anyway, they re-scanned my brain, and that little splodge in the middle is exactly where my stroke was. So it was quite a substantial stroke. And I just know that I, with my willing, with my repetition, with my focus and my drive and my goals, I'm doing this now. So what does fighting strokes do? I inspire. I empower people to make progress, more progress for themselves. It's all about progress improvement. And I hope to influence, which is why I'm talking to you and you and you and here, because I really think on the research level I've got a lot to offer on all sorts of things, from stroke and parenting to stroke incontinence to persistent vegetative state to, you know, so many issues that touch on my experience. And amongst all that, I go and visit patients, I give speeches, and I'm pretty busy basically. But I love it. And just if anybody wants to know, my first book, for all you clinicians, you will find that incredible, because I wrote that the day I walked out of hospital. I started writing it. It's very raw, it's candid, and it's on Amazon. And I don't like, you wouldn't want to be married to me, put it this way, when you read it, but I think you'll be inspired by it. I'm very proud of it, actually. It was a lot of hard work at the time when I was really, very poorly. It was all through phone interviews and stuff when I couldn't speak very well. My second book is one I've done myself, which really charts my emotional issues from following my stroke at home. So one's in hospital, one's at home. And I think, you know, the adjustments to family life, to kids, to parenting, to friends, to being a daughter, on top of the post-traumatic stress and everything else, depression and suicidal thoughts. You know, there's lots and lots of funny stories in that book, but you'll be able to pick out what was really going on with me at the time. And the next book is going to come out next year. It's called I'm Still the Same, and it's going to be a self-help book for stroke survivors by stroke survivors. It's going to have about 35 case studies in there. It's going to have actually a chapter from academics if they're, or clinicians if they're happy to write a bit, but it's basically a practical guide to help people make more progress improvement themselves, both emotionally and rehabilitation wise. And I'm funding personally the ebook version of that, but I'm looking for sponsorship for the paperback, which I think will be an audio, because I think they'll be immensely popular. And that's it.
It's actually, well, it's a real privilege to be up here with Kate, and I think it's a real privilege to have Kate and Tess this afternoon to talk about some real, I mean, that's sort of real life stuff, isn't it? The real life aspect of Tess trying to really get people to think, people working her pathway to get them to think about self-management and push themselves out their comfort zone, but also the very, very inspirational and practical and humorous talk that we've heard from Kate. So I don't know, have we got any questions? Because we've got a little bit of time. There's any questions that anyone has? I sort of feel that actually we just need to finish there, because really I don't think we can top what we've just heard, and I think that I'm just really grateful because Kate actually approached us and said, can I come and talk? And I'm so pleased that she was able to come today, so thank you very much, and thank you to Tess. There are evaluation forms for you to fill out. You know, this has been the first stroke rehab conference that MEDINEO has put together, so if it's something that people like, and we can obviously put the idea to them again, and I hope you've enjoyed it. So please leave the evaluation forms, and can you just give one last appreciation, or show your appreciation for all our speakers today. Thank you very much. Thank you. And the slides will be available in about 2 weeks, we think, don't we? Yeah. Thank you.